Intensive Residential Outreach Care, also known as IROC, is a pilot service that was launched in April 2022. The IROC service focuses on reducing the risk of Tier 4 escalations for children and young people. These children and young people present with complex psychosocial vulnerabilities and distress, and their needs are not always best met within the context of a Tier 4 admission.
So IROC's a little bit different to other services, and actually that's what's really quite special about it. It's a bit of a culture shift, and that's taking some time at the moment kind of just to embed in and kind of just bring that thought process really to the systems and the networks that we're working with.
IROC is an enhanced system support service, so by that we mean we work closely with the network and the systems that support a young person to manage the risk of mental health escalation and support their needs within the community setting. So the aim of IROC is to avoid Tier 4 inpatient admission for children and young people who present with relational distress. Our aim is to foster trauma-informed and attachment-led approaches to meet the needs of these children and young people. We work towards championing multi-agency support and partnership work through engagement with social care colleagues, education colleagues and mental health colleagues and any other relevant individuals who support the young person.
It's really exciting because we are working with the systems and the networks to support children and young people. So basically we work really closely with our partners and our colleagues in Referral Hub, for example. So if there's a referral through for a bed, then usually we're in attendance at those meetings as well to really just understand what the aim of an admission is, and actually can IROC be there as an alternative pathway to an admission. So we're there at the very start. And we're also working through lots of developments and pathways at the moment with our urgent care teams and pathways across the whole of the provider collab as well in the West Midlands, in order to identify those young people that often present in crisis with complex needs that are at risk of admission. So we're aiming to kind of change their trajectory and support them in the community, which is the best place within their own environment, local to their area, with their family, friends and education around them. And we want to enhance that and support that offer.
The wider aims are to hopefully achieve sustainability in terms of their mental health recovery and to improve their future outcomes. And we do that by working closely with all the key people supporting the young person. We work together intensively to develop things like formulations, which is essentially to understand the origins of some of the issues, thinking about alternative interventions and opportunities to support, thinking about how we might manage risk and reduce risk within the community setting, supporting families and young people when they are at points of crisis, but working collaboratively and therapeutically with all parts of the network is a really important part of the IROC offer. So our work focuses on giving the wider system the tools, the strategies, the education, the training to meet the needs of the young person. We have a multidisciplinary team in IROC made up of psychologists, nursing colleagues, occupational therapists, systemic family therapists, and our aim is to come together to think holistically about this child and their needs, but also considering them within the context of the environment within which they live.
So we work with young people aged 13 up to 18. On a case-by-case discussion, we have looked and worked with younger people as well from 12. And we work with all children and young people across the whole of the West Midlands Provider Club, so 6 ICB areas, so it's obviously a large geographical area. So yeah, we work with the systems that support those young people, often complex, challenging, children with care experience, so really quite complex needs, trauma, and we really want to just enhance and bring that psychological informed practice around. And we don't often work directly with the young person purely because evidence suggests, and from our experience, introducing a new professional actually can destabilise further. So we've got kind of a framework that we work towards in terms of securing a network around the young person first. And if we reassure, contain and stabilise a system around a young person, then that just trickles down to stabilise and contain and secure that young person as well. So literally, as we talked about, the trajectory is changing the young person going into hospital at all if possible. So it's really educating and working with that, you know, that systemic kind of whole network really, from all the statutory providers, everybody, in order to change and have that culture shift really to support young people in the community. So we focus on the front door, so preventing the admissions where possible. So if a young person does come out of hospital and for whatever reason that package of care is broken down or is not suitable, then they're going to come back to our attention, and we will again step in terms of actually what can we do to support this young person network in the community. So really bolster up and enhance that community package of care. We get referrals in from urgent care crisis home treatment teams, from local authorities, from our liaison colleagues across the acute paediatric settings, and we're doing a large piece of work as well with our urgent care colleagues and partners across the ICBs as well. So we really want to capture, support that community offer and support those young people at the right time with the right support.